Turning now to our continuing coverage of the closure of the supervised consumption site in Somerset West. Those in the area are sounding the alarm over rampant open drug use. Tonight, we're hearing from community advocates who say outreach workers in the area are on the verge of burnout, dealing with an increase in serious calls. The supervised consumption site was located inside the Somerset West Community Health Centre on Eccles Street. Since the province forced it to close in March, data shows paramedics have been responding to more overdose calls in a one-block area compared to the same time last year. CTV's Austin Lee is following this for us. And Austin, what more can you tell us on this?
Well, Patricia, I caught up with a father who has a child at the daycare on Somerset Street West. He and his family moved to the area about 2 years ago, and he says the result of closing the supervised consumption site is having the opposite effect of what was intended.
I've seen the change, so yeah, it's hard to see.
Needles, crack pipes, and open drug use. Just some of the things Javier Salazar sees more regularly in his neighborhood since the closure of the Somerset West supervised consumption site.
It is hard when you feel like you cannot just transit safely, like the area doesn't feel the same. You have to just pay attention where you're going or change sidewalks just to go to daycare.
His daughter's daycare is a short walk from the Somerset West Community Health Centre, which is why the consumption site was closed, a move by the Ford government aimed at protecting kids. But Salazar says it's having the opposite effect.
It wasn't like this, so I really seen changes in the last year.
There are similar concerns across the street from the health center at Cornerstone Housing for Women.
Our staff here are responding to overdoses outside. We see Somerset West and their team responding to overdoses and different crises out there as well.
And lately, the outreach team at Somerset West is being inundated with calls.
To give you an example, in June we had 23 calls from the community needing some assistance, and in September we had over 110 calls.
Funding for outreach teams is difficult to predict. It's kept afloat by a patchwork of short-term cash injections from all levels of government.
The funding needs to be base funding, where we're not cobbling funding together for these outreach services that are so critical.
For its part, the province says the move away from supervised consumption sites is working, pointing to a decline in overdose deaths across Ontario of more than 40% since April. But Salazar, who is witnessing the impacts firsthand, hopes to see the drug crisis addressed differently in his community,
while not worsening the situation for the community that is still at for the people and the businesses that are still present in the area.
Now, adding to the complexities of the overdose crisis, the potency of today's drug supply. Advocates I spoke to say over the past 10 years, with the rampant spread of fentanyl, social disorder associated with drug addiction has increased dramatically.